Hey, welcome back. So I hope you had a chance to watch the previous video in this series. If you haven't, please go check it out. Hopefully it will give you something to connect to or resonate with as a man. Again, while I hope anyone can find inspiration and motivation from this video, I'm speaking to men. I hope to keep this conversation going and to make it okay for men to talk about and take these GLP-1 medications. Again, I want to preface this with the fact that I am not a medical provider. I am not providing medical advice. I'm just speaking about my own personal journey and things that work for me. Please speak to your own provider to ensure that you're getting the proper care for yourself because your needs may be different from mine. Firstly, I'm going to talk about exercise and then I'm going to go into the medication and its benefits. So exercise, I personally think it's important on this journey to prioritize getting movement and resistance training in. Everyone won't feel that way, but that's just my stance on it. Often on my journeys, I would start working out and see results and then I would inevitably start having aches and pains from football pop up and derail me. A back issue here, a hip that needed to be replaced, knee pains, you name it, I have it. But using this medication has reduced the inflammation in my body and in my joints to allow me to keep going. It has also allowed the scale to keep moving while regulating my metabolic dysfunction. Those things in turn kept me motivated to keep working out on this journey. Just comparing my year-to-date workout numbers to last year's is mind-boggling. As of September 7th, comparing year to year, I've worked out an additional 100 hours. I have burned an additional 57,000 calories, and I have increased my distance by over 250 miles. When I first started this journey, I didn't work out for the first few weeks. Then I started incorporating outdoor walks along with Apple Fitness plus cycling. I have a body fitness bike where I removed the monitor and replaced it with a Roku TV that has Apple Play that allows me to cast to it to work out. Then I should probably start using my gym membership since I was paying for it. So I would get up at 4 a.m. and go to the gym 3 days a week. On gym days, I would do 45 minutes of cardio on the treadmill and 45 minutes of weightlifting. On days that I went into the office, there's 3 days that I go into the office and 2 days that I work from home. On 2 of those days, I would walk twice a day for 15 minutes, and that constituted me getting 5 workout days in for the week. Eventually, I decided that since I was already getting up at 4 a.m. on the days that I wasn't going to the gym, I should probably go to the gym on those days as well. So those office walk days transitioned into cardio only days at the gym where I would do 45 minutes to an hour on the treadmill. I think this gave me a better workout than those in-office walks and it allowed me to get my heart rate up and get the sweat going and get lathered up. I then added an additional cardio day. So that brought me up to 6 days a week working out. So that's 3 days where I did both cardio and weights and another 3 days where I just did cardio. As for my workouts, they go something like this. I did 45 minutes to an hour on the treadmill at a 3.8 mile per hour pace. As of the last month or so, I've added a level 3 incline on the treadmill to get my heart rate up. I found that not having incline, my heart rate was not getting up to where I wanted it to be any longer, so I needed to alter that a little bit. I do chest presses, 4 sets of 8. I haven't done bench, incline, and decline because when I first started on this journey in January, I had what's called frozen shoulder. I couldn't lift this arm above 90 degrees, and I was actually in the process of having a procedure to go in and break up the scar tissue so I can get range of motion back. But I think once I started taking the medication, that decreased the inflammation and that allowed me to have a full range of motion. Now, still painful, but I can move it without any issue any longer. However, because of the pain, I haven't been doing bench, decline, and incline. I wanted something more controlled. But recently, I switched that up to dumbbell presses because I'm focusing on tightening up the side of my chest a little better. So right now, I'm doing 5 sets of 8 of those. I also do a weighted abdominal coaster, 5 sets of 20. I then go to a linear leg press, and that's 4 sets of 15 with 4 plates on each side. And then that goes into seated cable low rolls, 3 sets of 10. And then on Sundays only, I do leg extension and leg curls, and those are 3 sets of 12s. Also on Sunday, I incorporate weighted crunches on a machine. That's 3 sets of 15. Additionally, on all days that I do weightlifting, I do dumbbell arm curls, 3 sets of 8, and tricep push down, 3 sets of 12. Now, there is a lot of fear mongering going on out there regarding these myths of muscle loss, and nothing could be further from the truth. Weight loss of any kind or being in a caloric deficit will cause muscle loss. That could be from a bariatric procedure, that could be from a medical condition, that could be from diet and exercise, or it could be from using these GLP-1 medications. On the reverse of that, you increase your caloric intake to bulk up. Someone like The Rock consumes 10,000 calories a day, I think, to maintain his muscle mass. So when you're in a caloric deficit, you're going to lose some muscle. But on this journey, you want to mitigate that muscle loss by getting in your protein and doing some kind of strength training. That could be weightlifting, that could be resistance bands, that could be using your body weight Whatever it is, you just need to do something to mitigate that loss. And of course, maintaining muscle mass is also key to your metabolism. You lose too much muscle mass and your metabolism will crash. This is something to keep in mind. At rest, a pound of muscle is 3 times more metabolically active than a pound of fat. So that just shows how important having muscle mass is. So now on to the benefits of the men. Something to think about for men regarding prostate cancer. And this is especially important for Black men who are 70% more likely to get prostate cancer and 2 times more likely to die from it. Having metabolic syndrome may put you at a greater risk for prostate cancer, and it will likely worsen the outcomes of your treatment for prostate cancer. Metabolic syndrome is defined as having 3 or more of these things: low levels of HDL, high blood pressure, high triglycerides, elevated blood sugar levels, and excessive abdominal weight. So you'll see people that are apple-shaped or have a large waist circumference. So these meds can correct all these things. And additionally, these meds have been clinically shown to reduce sleep apnea events by 63% and completely resolve it for 51.5% of participants in the study, reduce the risk of developing diabetes by 94% in pre-diabetics that are overweight or obese, reduce the risk of heart disease by 20%, reduce the risk of heart attack and stroke by 26%, lower blood pressure, lower cholesterol, reduce the risk of developing 10 of the 13 cancers related to obesity for type 2 diabetics. That includes gallbladder cancer, which is reduced by 65%, meningioma, which is reduced by 63%, pancreatic cancer, which is reduced by 59%, hepatocellular carcinoma, which is reduced by 53%, colorectal cancer, which is reduced by 46%, multiple myeloma, which is reduced by 41%, esophageal cancer, which is reduced by 40%, and kidney cancer, which is reduced by 24%. So as you see, there are so many benefits to these meds, and not just in terms of weight loss. They're allowing people to get off multiple medications such as high blood pressure meds and statins. And I'm sure there's going to be a lot more to come, these class of medications and the things that they treat. And we're not even talking about how they may actually end up extending your life, reducing and eliminating these comorbidities within your body, these diseases and sicknesses related to inflammation. So I got to ask you the question. What are you waiting for? Time to look into these medications and get started on your own journey.